We're going to get started, even though we have some additional people joining us right now. If you have not yet put your name, organization, and role in the chat, please feel free to do that if you'd like. And good afternoon, everybody. My name is Melissa Devlin, and I'm the Assistant Director here at the Grand Families and Kinship Support Network at Generations United. And thank you so much for joining us. We have our webinar today on strategies for using data to prioritize kinship care. We have two experts in that area joining us and looking forward to hearing from them. And we also want this to be an interactive conversation, so please feel free to put your questions that you hear along the way in the chat. We will collect those and address those at the top of the hour when we switch over to our 30-minute Q&A session. And also feel free to, just share in the chat your experiences on this topic. We just love to hear how everyone is using data in their kinship work. Next slide, please. For those of you who are not familiar, we are the National Technical Assistance Center on Grand Families and Kinship Families. We are wrapping up our 5th year doing this amazing work. And here are some of the ways that we are providing services and supports to government agencies, nonprofits, and tribes who are looking to improve services and supports for kinship families and grand families. We offer, for those of you who are familiar, we offer a centralized hub on our website. We host around 115 resources that are practical. You can search on our database for topics, and I think you'll find something for everyone there. Our website address is at the bottom of that slide. We also provide individual technical assistance to tribes, organizations, and government agencies. We have two TA specialists on hand to help you with those requests. All of our assistance is offered free of charge. And if you go to our website, there is a request assistance button, and we'd be happy to help you. We also offer learning opportunities such as webinars like these, learning communities, and also office hours to disseminate information on particular topics. And we love opportunities to get people together, even in forums like webinars, to be able to share information with one another about what's working and also some of the challenges that you're facing in your day-to-day work. And then finally, we are wrapping up our Bridging Systems for Kinship Families. It's a two-year initiative. And our goal there has been to bring together different systems that are serving families and jurisdictions to provide better coordinated services and supports for those families and try to make the experience more seamless for caregivers who are seeking help. Next slide, please. And today we have two wonderful presenters that are subject matter experts of the network. Noah Duncan is the executive director for Foster Insights at the University of Chicago, and Jack Tate is a data scientist at Foster Insights at the University of Chicago. And sometimes people think data is boring, but these guys really know how to make data exciting. And so we're so glad to have them back here today and share about using data in kinship work. And I will now turn it over to them.
Thanks, Melissa. Hey everyone, super excited to be here today. I'm Noah. I've got Jack here as well. We'll be kind of tag teaming the presentation today, which we're hoping to make pretty conversational. There are going to be some moments for you all to kind of contribute in the chat. And just really excited for this conversation around really just practical strategies for thinking about using data to prioritize kinship care. I think especially with some of the national conversation around a home for every child, kinship is going to be just a really important strategy in that new world. And so we wanted to put together some thoughts as we kind of pick our heads up from all the work that we've been doing with states across the country around this to just share out some of the things that we're hearing, learning along the way, so that you guys can kind of absorb that with us. So Jack, if you go to the next slide, Melissa gave a great intro to us. I'll kind of kick us off by just sharing a little bit about who we are and kind of why we can talk about something like the benefits of kinship placement. And then Jack's going to talk us through kind of really at a meta level why it's important to use data and what levers data can sort of help with when it comes to prioritizing and thinking about strategies around kinship placement. And we'll leave you with some really practical tips and strategies for thinking about using data that you may already have, or even collecting some new data that you could do really easily in a month's time to start thinking about how to use data to inform some of the strategies that you all might be considering as you prioritize kinship. If you go to the next slide, Jack, just a little bit more background on us. Our Foster Insights team was born at the University of Chicago. We're kind of an atypical group here in that we're not focused on publishing academic papers, but more so on really trying to make, Melissa said, making data exciting. We think about, trying to make data practical for folks who are in child welfare. Really, there's no shortage of data in child welfare systems, but it's sort of about figuring out what to focus on and how to make that information practical and actionable for the work that you do on any given day. We got started in this space 5 years ago, really on the data-driven recruitment side of things. Before we knew anything about the benefits of kinship or prevention, we started with really a home for every child. As we kind of dug into that concept, we realized that there's kind of a deeper why behind having those homes in the first place, that ultimately we have homes for kids who are in out of home care to keep them connected to the families, communities, people that they know, so that we can build that community of support around them in that moment of being in out of home care. And so we developed a concept to really think about that why, and it's called an adverse placement score. Jack, if you flip to the next slide, you may have heard about this in some of the national conversations, again, with the Home for Every Child. This is our way of just trying to turn really simple, placement outcomes into a measure of success and ultimately practical targeting of strategies when children are in out of home care. And we ask really simple questions with state child welfare data across the country to try to understand how often children are with relatives or kin, and when they're not with relatives or kin, kind of what is the outcome? Are they still able to be with their siblings close to home in family-based settings? Kind of the goal for every kid who is in out of home care. And this framework kind of gives you a way to think about not only putting kin first, but also thinking about what is the outcome when kin are not being used in a particular case. Does it mean that we have to separate siblings? Does it mean that we have to place a kid farther from home? And so this, perspective in doing this work has really over time just allowed us to build up our knowledge base and evidence base of why kin are so beneficial in the first place. We kind of, took it as an assumption from what we heard from child welfare agency leaders that who were wanting to prioritize kin. But if you go to the next slide, Jack, we have spent the entirety of a previous Grand Families webinar just talking about the data-driven kind of benefits of kinship. You can see some of the numbers we went through here. If you think about placement stability, distance to home, placement with siblings, permanency, all these different factors, kin are just making more positive outcomes for kids who are in care. Not only are those benefits for those kids, but also, Jack, if you go to the next slide, you can think about each of these from the system level as well. So if you're interested in kind of diving into that benefits of kinship piece, that really frames the conversation for today. I'm assuming we're kind of preaching to the choir on the benefits of kin, and that you all are interested in, okay, we want to prioritize kin. Now, what are some ways to use data to actually think about how to move forward on that path? And Jack's going to take you through some really practical guidance and strategies for how to do that today. If you've got questions along the way, don't hesitate to drop them in the chat. I'll answer any quick ones, but we'll save kind of the meatier ones for the Q&A session at the end. Excited for the rest of the conversation, and go ahead and take it away, Jack.
Thanks, Noah. And thanks, Melissa and Rowan, everyone at Grand Families for having us, and to everyone here, spending a portion of your day listening to us chat about data. We're super excited to be here. My name's Jack. I'm a data scientist with Foster Insights, as Melissa said, and I spend the majority of my time in our work focused specifically on what we do around kinship. And as Noah mentioned, a big portion of that has been understanding and building up this evidence base of all of the benefits of kin. Again, we know that we're kind of preaching to the choir on that front today. The one thing I would say is if you are interested in taking any of that information to your own agency and kind of taking some real evidence from other states to kind of show why kin is so important, if that's something that you're trying to work towards in your own state, recording of our previous webinar is available on the Grand Families website. Feel free to take that in whatever way it would be helpful. Today, we're going to take it a little bit more on a practical direction of, there's all these conversations around using data in child welfare. There's so much data that's out there. As Noah mentioned with the Home for Every Child directive coming from ACF and the pilot PIP, there's really this kind of big national conversation happening around, okay, well, what does data look like in child welfare? What does it look like for us to use data in a way that is most supportive to bring about the outcomes that we want for kiddos that end up in out-of-home care? And I think really what we see so much when we do this is that sometimes we kind of need to go back to first principles of, why does data matter? What does it do? And what are certain decisions? What kind of impacts can they end up having further down the line? And you kind of need to cover some of that before we even get to, okay, how do we actually want, our data reporting, our measures, things like that to be? And so we'll do a little bit of that today, related specifically into a kinship context. And then we'll finish by talking very specifically about something very concrete that you all can take back to your own agencies, something that we have done with a couple of our own agencies that we think is a really great starting point for how you can actually use data for understanding kind of where your kinship process might be having challenges and how it can be hopefully overcome to increase our placement with kin. The one thing I would say in all of this is we try and make data as accessible as it can possibly be. We're not in the business of overcomplicating things to try to make ourselves sound smart. It's not who we are. It's not why we're here. So hopefully, all of this is very much trying to show that data is something that anyone can use. It doesn't require, any kind of math brain in many ways. It actually in many ways requires kind of more of that more art than science side of your brain of kind of understanding how all these things tie together and then how we can make decisions in the right way to make sure the data that we are collecting and using is having the impact that we want. So that was a lot of, kind of introductory spiel. The one last thing I would say, Noah's already put this in the chat, but please feel free to put questions in there as much as you have them as we go through this. If there's any quick things, we'll shout them out and deal with them in the moment. Any kind of bigger picture questions, we'll save for our Q&A happening right after this. We'll chat in much more detail about some of these questions, hopefully have a bit of a discussion, hear more from all of you about your own experiences on this topic as well. So to dive right into it, I wanted to start to hear a little bit from you and hopefully get some thoughts in the chat. We just want to try to understand, how does data typically show up for you in your day-to-day work? In which ways do you typically see data? In which ways do you typically interact with it? How does it impact your work? How often is it something that you're interacting with? Is it something that is coming across your desk and you're thinking about every single day? Is it something that more so comes every quarter, every year, every 6 months, every week? Whatever it might be, would love to hear a little bit more about your own experiences here from all of the various positions that you will take up. Kind of how does data show up for you? How do you use it? And to what extent is it having an impact on you every single day? We're always wanting to learn a little bit more about exactly the ways that it's showing up so that then we can hopefully tailor, some of the work that we do to make sure that it's fitting into these kind of systems in a better way. And hopefully we can kind of inform some of the conversation we have, not only in this first kind of hour, but in our conversation happening afterwards as well. So please feel free to, put comments, thoughts in the chat. Would love to hear from all of you so that we can chat more about it in detail later on. One way while we're hopefully getting some thoughts from all of you, then we wanted to share a little bit about the way that we have seen data typically show up in child welfare, not so much in our work, but just the kind of prevailing sentiment around data in this field. And I think very often, the way that data shows up is very often for the purposes of reporting. I have a few screenshots in here of things like the AFCARS database, some state-specific databases, public-facing dashboards, reporting on metrics that states have adopted, as being important for them in understanding the performance of their child welfare system and how it is serving children in care. I think, it's I think very understandable why this is what we typically think of when we think about data, because these are in many ways the most public facing, the most easily accessible, easily recognizable ways that data shows up in child welfare. We have to go back again to the new pilot PIP previously. We've had so many metrics that child welfare agencies are being measured on every single year or every few years. So all of these different federal measures, even now as part of a Home for Every Child, even though we've kind of stripped back on those specific measures, states are now building their own from the ground up. These are things that we think about. They might come across our desk every quarter. In the case of a Home for Every Child, every month, maybe every year, every few years, whatever it might be. I think that this is often kind of the prevailing sentiment around data, especially in kind of the national conversation. And as part of that, I think something that can somewhat be lost, and maybe many of you as folks that are kind of working more on the ground see it used in this way a little bit more. I think something that gets lost is how much data really impacts that everyday decision making that is happening constantly all across the country. And I think we kind of need to go back to that principle very often to make sure that the kinds of metrics we're putting in these reports are really kind of driving the types of decisions that we hope we are making, and driving the right outcomes that we're trying to strive for when we choose all of these metrics. Just a few examples. I'm sure it's not news to many of you on this call. You're probably experiencing this every day, but just how much data can impact the way that our work looks every single day. In a resource constrained environment that we're obviously in child welfare, we're all having to make decisions and trade-offs about where we're going to spend our time, where we're going to put resources, how we're going to structure all of our work and our organizations. That can come in the form of prioritizing certain tasks. If you know as a placement desk, for example, that you're being held accountable to one thing, you're probably going to prioritize your tasks in a certain way to make sure that you're hitting whatever you need to in order to prioritize that metric that you're being held accountable to. Similarly, when it comes to just individual decision making, whether consciously or subconsciously, certain decisions are likely being made as a result of data that we're being held accountable to, by our leadership. It's really, impacting every single small decision that we're making in many of these things. And then from a slightly bigger picture level, just how a workforce is structured, has such huge impacts on how resources are prioritized throughout an agency. And data, again, is a huge part of that. Noah and I have worked in a number of states that have had new initiatives pop up over the last few years, some of them specific to kinship, and that has drastically changed how workforce is structured, how certain resources are allocated differently to different departments within an agency. All of that in many ways goes back to data, and it again is maybe the part of this that we don't think about quite as much in terms of, okay, yes, we have this reports that maybe we only think about once a year when they come across our desk and we see an annual report, but are we kind of thinking about how it's actually showing up every single day, all of the individual small decisions that go in to that yearly report, it's kind of summarizing how our system works. So we like to take it back to these first principles and then kind of work from here to say, okay, well, given that data is going to impact what we do every single day, how can we kind of design our metrics that we're using to understand how our agency is performing to really make sure that we're getting at the outcomes that we truly want, and not maybe something that is close, but maybe not quite exactly, the kind of thing that we're really shooting for. Really, the impact of all of that just means that the stakes for choosing the right metrics is so much higher, and we want to make sure that all of these things we're holding ourselves accountable to are driving the outcomes that we really want. I think we have come across many scenarios where I think we have felt that metrics that certain agencies are using, while really well intentioned, are maybe not exactly right to actually drive the right outcomes, and are maybe creating some trade-offs that we didn't consider when we implemented these metrics. And that's kind of the conversation we want to have for the next kind of 10 minutes or so here. The two biggest, I think, challenges that we see when we talk about trying to create the right kind of data that is truly, leading us to the outcomes that we want for youth in care are these two that we have here. Firstly, certain metrics, again, although really well-intentioned and important in their own right, maybe what we would consider like necessary but not sufficient. They are important and they need to be captured, but they only are capturing a relatively small piece of a much bigger pie. And if we're not capturing that entire thing, on its own, it's maybe not quite enough to really make sure that we're getting to the outcome that we truly are after. And then a slightly different point of view, we often also find that a metric that we're choosing to use to measure the performance of our child welfare systems can sometimes be a little bit too far removed from the ultimate goal that we're actually trying to use. We'll go through a couple of examples of both of these to kind of show how they can show up, especially as it relates to kinship in particular, because these have really big impacts that we've seen in multiple states that we've worked with across the country. One way that you can think about this, something that we see very, very often on the front of a metric kind of only capturing one piece of this much wider puzzle, is very, very common metric that we see in agencies that have the goal of increasing their proportion of placements that are with kin, is this metric of what percentage of our first placements are with kin. I think we would all agree this is a goal that we should be trying to strive towards. And I think, not only do we want to try to increase placements with kin wherever possible, but doing it as early as possible, is a goal that I think we would all probably agree with and agree that it's something that we should be striving towards. And so it's very, I think, understandable and sensible why we would turn to that as our metric to say, this is the thing that we really want to care about as, okay, this is going to determine, whether we're improving or not in terms of making sure that youth in care are connected to their families and really accruing all of those benefits of being placed with kin that we talked about at the very beginning here. You can think of the good hand of this. One of those good outcomes is maybe we're then putting a lot more resources in terms of workforce. Maybe we're putting a lot more folks to do initial kin searches. Maybe we're putting a little bit more funds behind that. Maybe we introduce some sort of new relative search and engagement software to help with that search. And so we do get more initial kin placements, and that's great. It's something that should be celebrated, kind of the outcome that we were hoping for here. On the flip side, though, and I think the thing that can sometimes get a bit lost and hidden as part of this conversation is, okay, we might be having more initial kin placements, but there might be also a trade-off on the backside of that, in that we're putting so many resources, so much of our workforce towards that initial relative and kinship search. There's actually less continuous kin finding happening. And it's something that we have come across in, to be honest, almost every state that we've worked in across the country, that we've seen this big push towards initial kin placements, which is great. But what we then often see is if a kiddo comes into care and we don't find kin on day one, in many cases, it's fairly rare that we then ever place with kin after that. That obviously has impacts for the entire rest of their time in care. It's especially important for kiddos that do spend a significant length of time in care. In an ideal world, and again, we're obviously working in a very resource-constrained environment, but in an ideal world, we'd probably be doing these kind of kin searches maybe every couple of months for kids in care to make sure that we're constantly exhausting all of our options there. Maybe we identify a new possible kinship option, or maybe we manage to engage a kinship caregiver that we weren't able to before. Ideally, we would be continuing to do that, not only for kids that aren't placed with kin initially, but even for those that are. Another way that we see this show up is that if a kiddo is placed with kin initially, but that kinship placement disrupts, it's then very rare that they ever make it back to kin again. And so this is just an example where that metric of first placements with kin that we think is very well intentioned, because there's this wider picture going on beyond that, that metric can kind of force us to focus on this small piece of the puzzle, even though there's that wider picture that then might be getting slightly neglected. And it all comes back to the way that we're holding ourselves accountable for the performance of our agency. Another one that we see a lot here is on the realm of placement stability. It's very, very common, metric, obviously, in child welfare, and something that we've come across a lot. And again, I think we would all agree that more stable placements is a goal that we want to strive towards. All else being equal, we don't want to create any additional disruption to youth lives while they're in care through the form of moving to a different placement. A metric that you can imagine for that is just quite simply the number of placement moves. Or, as part of the previous version of the PIP, the federal measure of this was, the number of moves per 1,000 days in care. You can think about different ways of measuring it, but all under the guise of, really just how often are kids in care moving from one placement to another. I think this is an absolutely, fine goal for us to strive towards. And you can think about the good part of that being, as it relates specifically to kinship, maybe there's a little more resources going towards support for those kinship caregivers. So especially, if we have kids being placed with kinship caregivers that have higher levels of need, maybe we're doing a little bit more to try and support those kinship caregivers through trainings, through additional staffing visits, whatever it might be, to try to ensure that they have the right support in place so that placement can sustain over a long period of time rather than disrupting. On the flip side, though, similarly to what we saw with the first placements with kin as our only metric, this metric can have a kind of downside to it as well. And that is, once again, this kind of idea of less moves to kin happening later on if a kinship placement does disrupt. You can imagine this outside of kinship too. It's something that we come across all the time. In a couple of states that we've worked with, we've heard that sometimes the focus on placement stability as a metric to which staff are being held accountable can sometimes make staff hesitant to, say, move a kiddo out of a congregate care facility and into a kinship placement. Even though I think we would all look at that and say that's a great thing that we should be celebrating, but because of the things that they're being held accountable to don't necessarily take account of that nuance, if all we're being held accountable to is something like the number of placement moves, it can sometimes kind of paralyze us in making that decision, and really end up leading to something that I think we would all look at and say that's not the outcome that we wanted, even though on paper the metric looked like it was doing the right thing. It maybe wasn't exactly where we needed it to be. We kind of think of this as maybe slightly more of an input to an overall goal as opposed to the goal in itself. And so we have it here. I think the placement stability, the goal of it is just to make sure that kiddos are staying in the most supportive placement they can for as long as they can. And the ways that we do that maybe need slightly more than just purely the number of placement moves.
I just add on that too, like another kind of example that is maybe less metric focused, but more like context focused, where it's not uncommon to hear that after 3 to 6 months in a non-relative placement, a kid is kind of deemed as like stable there. And even if a kinship option comes along later, we don't want to kind of induce a move because maybe they're stable here, they might not be stable here, and what do we do in that case? It's not even necessarily thinking about the metric in that case, but it's thinking about the stability of the child in making that move. And I think that's always going to come down to a case by case decision. But at the system level, if we have in certain areas of the state, a bunch of kids in those non-relative homes that actually have viable kinship options for them, we're sort of like holding a bunch of non-relative homes that could be used for kids who really don't have those options. And so there's a cost in those cases to not really asking the super hard question of, does it make sense to move, even though this kid has maybe been here for 3 months and it looks like they might be stable for a long time to come? Could we now open up a home for a kid who is sitting in a group home today because we don't have this non-relative home available to them? And so I think this kind of manifests in different ways, where it's both explicit and kind of implicit around placement stability. And it's always a hard conversation, but I think one that you just ask the question, does it make sense in this case? Because there are costs of not having that move in the first place.
Yeah, really important point. I see a comment from Kimberly in the chat about, free up the non-relative homes that we have for children who really need them, and, make sure we're utilizing those kinship placements wherever we have identified possible kinship caregivers. I think firstly, a great point, and hold on to that because we will come on to, I think, a very specific point on that front in just a few minutes here. It's something that we saw that really shocked us in one of our states and is kind of the genesis of what we're going to talk about at the end here. So, I think it's worth saying that I don't want to come across as if we're saying that folks making decisions based on metrics they're being held accountable to is a bad thing. It's not. If anything, in some ways, it's actually a good thing. It means that the data that we're using and the metrics that we choose to implement can actually have a really big impact. Noah mentioned at the very beginning, we wanted to talk about the kind of levers that data really allows you to pull on and how it can impact things. And this is one of the ways that it does that, right? Folks respond to what they're being held accountable to. And that's great because it creates opportunity if we get these metrics right, that we can really drive change in our agencies. But given that power that they have to change behavior, to change the way that we structure our organizations, it makes it even more important to get that decision right. And to do that, we like to kind of ask ourselves two questions. And we'll actually show you an example of kind of how we think about this. We try to ask ourselves, firstly, before we even talk about data, and this is why I say I think being good at doing this is actually slightly less about being a math whiz or anything. I haven't taken a math class since my sophomore year of high school. I'm not a math whiz, even though I use data every day. It's actually much more kind of art than science. And if we go back to our very first question, what is our desired outcome? And that entails, I think, a broad goal of maybe we want to increase how many children are placed with kin when they're in out-of-home care. But then it also entails then getting a little more specific than that at times in terms of, okay, well, how do we want that to happen? What would be our ideal, but also if what would happen if we were kind of optimizing for that too much, and would there be these other trade-offs? And then secondly, what is this possible metric or a metric that we propose? What could it be missing? And in some ways, that kind of requires really sort of gaming out. Say with something like percentage of first placements with kin, you kind of have to put yourself in the shoes of someone who would be actually making these decisions every single day. If you're a leader in your organization, kind of ask yourself, okay, what would happen if someone is following that to its absolute max? And then what would the outcome be? And through doing that process, you can kind of understand how we might end up getting somewhere that, yes, is accomplishing something on one hand, but maybe we have these trade-offs on the other, like we talked about, that aren't quite hitting the outcome that we really wanted. A way that we think about this is that doing this in the best possible way might require kind of layering some things on top of each other, to make sure that we have a really comprehensive metric that is really going to help us accomplish the goals in the way that we want to. So we were going to think about something like increasing the number of kinship placements, for example. I think the broadest metric that we could imagine to measure something like that would simply be, on any given day, what proportion of children in care are placed with kin. And that comes from this point of really just wanting to make sure that all children in care, as much as possible, are with kin. So we start with that, as our place to begin with, because that is just the broadest way that we can truly capture this and make sure we're not, kind of, I don't want to say completely forgetting one side of it, but maybe putting one piece of this to the side, as we might do with certain ways of measuring this. But then you can kind of imagine the downsides of having something that broad is that it maybe makes it a little more tricky for us to get really specific about how we want to do that. So that's where you can imagine kind of layering some of these things together, to make sure that you can understand the specifics of how we actually achieve that goal. So the way that we might think about something like this is, okay, out of the number of percentage of children placed with kin overall, we can then break that down by how many are placed with kin for their very first placement, how many are placed with kin by their second placement, how many are placed with kin by their third placement. And you could imagine doing something like that a long way down the line. You could think about doing this also, instead of the number of placements, but by length of time in care. So it could be, what proportion of kiddos are placed with kin during their first week in care, or by day 30 in care, or maybe by the 1 year mark in care, to make sure that we have this kind of all-encompassing way of looking at this issue. You can even see this, just to go back to the very beginning, Noah introduced our adverse placement score framework. Even though we end up through our adverse placement score metric that sums things up in one number, you could see from that flow chart that Noah showed, it's actually really kind of 4 metrics in one. It's our kinship rate, it's then our rate of placing in non-family like settings, our rate of keeping siblings together, and our rate of keeping kids close to home. So, we're really trying to be comprehensive in all of that. And you're kind of drilling down one layer deeper in each part of this. Somewhat as a way that we would think about this, not necessarily the way that everyone has to think about this, but I think just an example of how we try to be both comprehensive in this kind of summary metric, but then drill down and get a little bit more specific underneath that to make sure that we have some direction for specifically how we can kind of achieve that overall goal.
I think I would just add on this slide, part of what we're advocating for here is not even like a, specific kinship metric, but just to kind of, I think like Jack said, it's not even really a data question. It's more of a, kind of art question of what is the goal. If the goal is, first placement with kin, but then the goal is also for those placements to be stable, you kind of want to have both of those things, but you also want to make sure, your overall kin placement rate is going up. So you might have kind of different things that you put under different parts of the process that you're looking at, so that you have that fullest picture. I think what we're saying is if you focus on any given one thing, you just might miss another piece that would that could ultimately be leading to the outcome that we don't want at the end of the day. If we really just want all kids to be with kin as often as possible, that's sort of the main thing. And then we can develop sub measures of success for each part of that we want them to be with kin as early as possible. We want them to be in as stable of placements as possible. And that's kind of a kin selection, kin support problem. And so those are just different things that you would parse out. So just kind of different ways to think about this. But I think ultimately, the leaders who are in this room are going to have the local context to know what are the different things that I want to achieve success with, and how can I develop just a really simple measure around each of those things so I'm not missing one part of the pie.
I think even there was some conversation in the chat earlier on about, the it's all well and good kind of having the numbers of kinship caregivers, but are they getting the support that they need? Are the service providers getting the support that they need? You can even imagine that as one of these kind of sub components of this overall metric there, in terms of we've been working with a state that recently on the kinship and non-kinship side introduced just like a one question satisfaction survey that goes out every single month to their kinship and non-kinship caregivers, just to try to understand like what's going well, what's not going well, how can we support you. And that's been really effective at just improving the communication piece. It can be something much more qualitative in nature like that as well. It doesn't have to be sort of just these raw numbers in the way that we're talking about them now, but it's the most important thing is just that comprehensive nature and making sure that it is encompassing all aspects of this issue and this challenge that we're trying to accomplish.
And what was crazy about that survey too is they sent it out the first month. They got like 600 responses in the first week. 500 of them had narrative in them. It's just a one question survey with a text field, like, how likely are you to recommend fostering, basically. And in the text fields, they would parse through and they saw like multiple kin caregivers who were saying, I've been trying to get access to these services, but I haven't found the right channel of communication. And by just having a way to kind of elevate that to folks who could do something about it, they were able to save like a kinship placement before the disruption happens. And so just creating, I think it's a really great call out, Jack. Like if there's a measure on kin satisfaction in general, it could also be a venue to support kin stability in real time if we're doing that in a way that is kind of more regular, kind of preempting that, stability piece by just asking up front, how are things going?
I think again, it just goes back to this point that data doesn't need to be very complex. Like when we talk about data, we're not necessarily talking about running like super complex mathematical models or anything. It can literally just be this state just use Qualtrics, which I'm sure like everyone on this call has used or at least is familiar with at some point in their career. It can be very easy like that, and it really is just a way of gathering information in whatever way that looks. It's going to be different in different contexts, but it really is so much of this just ability to kind of think through a problem as opposed to necessarily understanding all of the nuances of like various very complex math that goes into all of this. I think in many cases that's just overcomplicating it, and actually just keeping things simple is in many ways the better way of collecting some of this information. So that was, I think really good conversation on just why data matters. I was looking at the chat a little bit while I was talking, and I did a lot of good stuff in there that we'll hopefully get to in our Q&A after this. Having kind of talked about why this is important, we also wanted to get a little bit practical for the last sort of 15 minutes that we have here and talk about there's so much focus on this very, very broad idea that okay, we need to be placing more with kinship, we need to be placing more with kinship wherever we can, and that's great, but it's such a big challenge. There are so many aspects of the kinship process, where right from the identifying and engaging with kinship caregivers to actually making a placement to sustaining that placement and supporting the kinship caregiver. There's so many different parts to it, and it can feel very difficult to understand, okay, well, where do I start with this? And if I wanted to try to use data to inform where I start, how do I do that? And so we're going to talk a little bit here again about something very simple that hopefully all of you could do in your own agencies to try to understand how data can help you understand where you might want to focus efforts to try to increase the proportion of kiddos that are placed with kin and make sure that they're stable in their placements when we can find them. So as we go into this conversation again, we'd love to hear from you in the chat here. We already talked about some of the things you put in the chat today already. We'll hopefully do the same in our Q&A after this. So we would just love to hear in your agency and your role, what are the biggest barriers that you find to placing more children with kin? Is it on the kin search and engagement piece? Is it on the actual placement side? Is it more on the stability side? There's already been some conversation on making sure that we're supporting kinship caregivers. Is it something else entirely that we're not even talking about? We would love to know exactly the barriers that you're facing so we get a little bit more context. Is it something to do with the courts, for example, is another one we've come across. We just love to learn a little bit more about your context, to aid our understanding, but also hopefully to motivate some conversation of, the some conversation that we'll have in the Q&As afterwards. So I think the way that we like to start with this is just trying to break down the kinship process. I think so often when we have talked with states about, especially on the data side, how to use data to improve the number or increase the proportion of kiddos placed with kinship caregivers, so much of the focus immediately just goes to, okay, well, I have to just find more kin. I have to improve my kin search. I have to engage with more kin. But actually, the kinship process, as we've already talked about, is a lot broader than that. And it also encompasses making placement, trying to stabilize that placement once it gets made. And so we really want to try to break down this process as much as possible. And, as we do that, we like to kind of break this down into the kin search piece and then the placement piece. The kin search being, how do we identify kin, and then how do we engage them once we have identified them. And then on the right-hand side, kind of this more placement-based approach of once we've identified and have engaged kinship caregivers in tow, how do we actually make that placement? How do we make sure that placement is stable over a long period of time? And again, we've found in our experience that immediately within out-of-home care agencies, generally the focus tends to go to this left-hand side of the kin search piece of it, which I think is understandable. But we wanted to share an example from one of the states that we worked in as to how that maybe doesn't encompass everything that we could look at when it comes to understanding how we could improve our kinship search and placement processes. And so, in this one state, I'm not going to name the state just for their privacy, but this is a real example from one of our state partners. We had a bunch of data from them on not only kinship placements, but also the actual search process. And so we went into this, and they challenged us to try to help them figure out how they could place more children with kin. And really, both their focus and our initial focus was, okay, well, what can we understand? What can we learn about that search and engagement piece? Are there areas in there where maybe we can understand where they're not engaging with kin as much as we would hope, or they're not finding kin for us in a certain area of the state, or maybe for a certain demographic, maybe a certain age group of kiddo in out-of-home care? What we actually found was that if you looked at the kids in out-of-home care in this one state who had never been placed with kin during their time in care, 40% of them, as many as 40%, actually had kinship options that not only were identified, but responded to that engagement and actually said that they would take placement of those children. Now, obviously, you can imagine there are reasons in some of those cases why maybe that kinship caregiver couldn't get approved. Maybe the communication ended up breaking down. Maybe the kiddo was already on the verge of adoption with a non-relative home, whatever it might be. But that was a incredibly high number to us. I think it was very shocking, and shocking to our state partner as well, that they had identified and engaged with so many of these kinship caregivers who had said that they were open to taking placement. And yet for some reason, there seemed to be some sort of barrier that was prohibiting them from actually making these placements. And so quickly for us, our question became, okay, well, maybe the barrier is actually slightly less on the kinship search and engagement side and a little more on the actual making placement side. It was an interesting distinction to us, and in that one state, they're now making a bunch of changes to their process to make sure that there's more follow through once a kinship caregiver has been identified and responded that they would take placement, to make sure that either that placement happens or that we have a documented reason as to why it maybe isn't possible. So I think just an example we wanted to bring up of why we like to break things down like this, and not only just look at the kin search piece, which is maybe where focus tends to go immediately, and look a little bit more also at, we have this kind of slightly further down the line aspect of this too, and making sure that we're utilizing that in the best way possible. And so that really brings us to having a couple of buckets of questions here that we're going to talk about how you can use just very, very simple information to try to understand. And those two questions are, firstly, is it that we're struggling to find kin? So is it more on the kin search and engagement piece? Or is it more that we are identifying and engaging with those possible kinship caregivers, but it's then the kind of coordination and the follow through on the placement side that is our barrier that we seem to be running into? We're going to look at what data might look like for each one of these examples and kind of explain a little bit about how you all could probably do this in your own agencies to try to understand some of this too. And the way that we're going to do this is we're going to use a bit of a fake spreadsheet that we have set up here, just 3 rows. And this will mimic, at least to some degree, I'm sure, something that many of you have in your agencies already. It is really a what you can imagine as a kin search spreadsheet. So in a few states that we've worked in, we've managed to chat to the kin search and engagement teams that all of them have had a spreadsheet that looks something like this. Where we have whichever kiddo we're doing the search for, when the search happens, and then what are the outcomes of that search. Very, very simple data. Again, it's literally just a spreadsheet that I'm sure many of you in your own agencies have already, at least somewhere. Maybe it's not necessarily in an official CWIS or SACWIS system, but maybe it's kind of a little bit more unofficial, just used by one department, maybe just in an Excel spreadsheet. We always advocate for just starting with 1 month. Just look at 1 month's worth of data. That's obviously not going to tell us the entire story, but it's a good starting point, I think, so that it's not too overwhelming. And we're just trying to get kind of a story of what might be happening in this 1 month and what it can tell us about the kinship process in our state. So we'll firstly look at, what would this kind of look at? Sorry, what would this kind of look like if the barrier that we're facing is the fact that we just can't find and engage with kinship caregivers as much as we might want? And the spreadsheet might look something like this. So we'll go through this step by step to kind of show what this is saying. So what we're showing here is we have these 3 kiddos who are all in care, in out-of-home care. We have our kin search data here, and we just simply have information for the number of kinship caregivers that we contacted, the number of kin that responded, and the number that responded in particular that they were open to taking placement of that child. You can see in this case, what's happening is we're just not getting that many responses from the possible kinship caregivers that we've identified. For this first kiddo, we didn't get a single response. For the second one, we only got 1. And for this third child, we only got 3 responses. And in all of those cases, even the ones where we did get an initial response, we didn't get any who responded that they were open to taking placement. This might be, what this spreadsheet would look like if it seems like the barrier is that we're simply just not identifying, engaging, and kind of getting possible kinship caregivers to the point of being open to taking placement. And if that's the case, that would then lead us to ask these kind of questions. How is this initial kin identification process working? How does that actually happen? Are there ways that could be improved? How are we reaching out to those that we identify? We know that many agencies across the country are still primarily using mailed letters to contact folks. Well, that obviously has some difficulties just in terms of speed and how quickly we can get in contact with some of these folks. Are we reaching out to every single kin option that we identify? We also know anecdotally from our conversations with folks in states across the country that in many cases, even if there are 10 possible kinship options identified, maybe not every single one of them is being contacted. And even if they are all being contacted, maybe the follow through isn't quite the same on every single one of those options. And then lastly, really importantly, which we're going to talk about a little bit more in just a second, not only is this the outcome we're getting, but what kind of responses are we receiving? Yes, all these folks in this example are not saying they're open for placement, but were they open to other forms of engagement in this kiddo's life? Is that still an option to engage that kinship caregiver in this case, at least maybe as a respite option, or maybe to take them to a baseball game or to take them to, a ballet class, whatever it might be, to, have that kind of family and or non-relative kinship option at least kind of involved in this kiddo's life during their time in out-of-home care. And that then leads us to this last column here, which just is the barriers to placement. This is more of a notes column. And, we've talked a lot about how this doesn't need to be particularly math-based, and that actually qualitative data, this written piece, is just as important as the numbers piece. And in a case like this, what we would look at is, even though the numbers here, how many kin responded yes for placement, for example, can help us understand what happened, these written notes can really help us understand why and get even more specific about the roadblocks. Because what you might find is that, okay, we're identifying a lot of possible kinship options, but they're not responding yes to placement. Well, maybe it's all because of a reason that we can actually deal with. Maybe it's difficulties on the licensing front. Maybe it's financial concerns. Maybe it's that they're uneasy about state involvement. There's also, a bunch of relationship dynamics involved with possibly with the bio family that we need to take into consideration. And you might see that there's actually a huge pattern here. And so it just enables you to get super, super specific about exactly which barriers you might be running into. So this is an example of what this might look like if the thing we're struggling with is more on the search and engagement side.
I think
Very
Jack's going to
quickly,
go through another example here, and I try not to slow him down because we only have a few minutes left. But I think the inspiration from this spreadsheet comes from really like, personal budgeting, where this is something you could do just in, 1 month over the course of the month for all of the, children who come into care that month, just to kind of see where things are at. On the budgeting analogy would be like you figure out you have 3 subscriptions you didn't even know you had. Is there an equivalent to that on the kin search placement, support side that's just a simple exercise like this in 1 month could help you come to? And I think Jack's demonstrating here how that qualitative piece is just as important to the quantitative piece, because we actually need the meat of what's actually going on here under the hood that's explaining what's going on. The quantitative data can only kind of get you so far.
yeah, and it's a great analogy with the budget. And I think what is specifically, I think, useful about this is so often folks that are working in kinship units within child welfare agencies are very, very familiar with this kind of information on a case by case basis, but maybe just don't have the time to kind of go one level up and look from this like 10,000-foot view and actually maybe see, okay, well, as we found in that one state, like 40% of all of these kiddos we're finding possible caregivers for, but for whatever reason the placement isn't happening. I think just being able to take that step back and look at this from that 10,000-foot view makes a huge difference. It's why we always suggest just do this over a 1 month period, because it's small enough that it's not so overwhelming and hopefully won't take too much time, but it's also large enough that you kind of get that broader view. So to end here in the last couple of minutes, we'll just look at what this might look like if it's the opposite problem, the one that we found in our one state that we work with. On is it actually that we are finding kin, but we're just struggling to actually make that placement? And in that case, the spreadsheet might look something like this. And so what you see here, differently to the previous version, is we have a lot more possible kinship caregivers responding to that initial outreach. And then crucially, we have a lot more possible kinship caregiver options responding yes to the idea of taking placement of that child in out-of-home care. But still, none of these 3 kiddos in this example were actually placed with kin. Eventually, they're all still with non-relative caregivers. And so for us, that would bring up a very different set of questions to the previous example. Why were these children unable to be placed with kin? Is it because maybe, again, there are reasons why maybe communication breaks down, or maybe actually we tried placement as a trial basis on a weekend and it didn't go very well, or maybe they're in a super stable non-relative placement that's about to adopt them, and so it didn't make sense to disrupt that placement. Whatever it might be, that there might be reasons for that. But I think in many of these cases, at least in our experience that we have come across, it tends to be more coordination challenges. And so how do we overcome those? And then once we can identify those barriers, are any of those addressable, especially as it comes to the approval piece of this, where there's so much action happening around the country with model licensing standards, for example, changes in kinship caregivers approval procedures, how we're doing those kinds of things. There might be ways that we can support more of these placements happening. And then once again, it goes back to the qualitative data piece of this. These written notes become so important here. And these are all obviously made up, but the kinds of challenges that we have come across many times in our conversations with states around why some of these placements maybe aren't happening. And so then it allows you as folks in your agency to try to understand, well, what additional supports do we need to maybe calm some of these nerves from kinship caregivers who say they might want placement, but then it ends up not going through? Or if it is more just pure coordination challenges, do we need a slightly different process for how we move these cases from the kin search to the kinship placement side of things? In our one state example, what we found is that once the kin search was done and kinship had been identified, it was then passed to a completely different team who did not have a prior relationship with that kinship caregiver. But then there was no follow through. Folks were just so busy. There was no procedure for them to check in with, say, the placement desk and say, hey, was that placement successful? Were we able to make it? They didn't have any insight into whether that placement was ever made. They were just moving on, to the next kinship search. And so in that case, it was a pure coordination challenge, and we've helped them implement a slightly different system for how they can actually go about doing this, and they're trying to implement that now. So that's just an example of how we can do this. And the very last thing we'll say is, as we talked about in some of these coordination challenges, I think one of the biggest things we see is, in that example we just gave, teams operating in silos can be very difficult to overcome. And so, to whatever extent that it is feasible, sharing success, sharing struggles, not only within an agency but also between agencies. And Melissa and Ro, it's why something like Grand Families Network is so powerful, because we can share these kind of best practices across states, across agencies as well. It's such a useful forum to have to be able to do this. And I think that's ultimately what's going to allow us to kind of grow from all of this, making sure that we are using these best practices wherever we can. That's all from me. Thank you all so much for listening and all the conversation in the chat. I'm very excited to talk more with all of you in the Q&A right after this. Melissa, I will hand it back to you to wrap us up.
Thank you so much.